What is Mpox? Mpox, previously known as monkeypox, is a rare viral disease that causes skin rashes and flu-like symptoms. It's part of the orthopox virus genus, the same family as the smallpox virus. The disease spreads through close contact with an infected person or animal. There are two known types of the Mpox virus, clade Y, originating from Central Africa, and clade 2 from West Africa. How is Mpox transmitted? Mpox can be transmitted from person to person through direct contact with infectious skin or lesions, including those in the mouth or on the genitals. Transmission can occur in various ways, including face-to-face contact, talking or breathing close to an infected person, skin-to-skin contact, such as touching or engaging in vaginal or anal sex, mouth-to-mouth contact, kissing, mouth-to-skin contact, oral sex or kissing the skin. Through respiratory droplets or aerosols during prolonged close contact, the virus enters the body through broken skin, mucous membranes such as oral, pharyngeal, ocular, genital, or anorectal surfaces, or the respiratory tract. Mpox can spread to other household members and sexual partners, particularly among individuals with multiple sexual partners. Transmission from animals to humans occurs through bites or scratches from infected animals, or during activities such as hunting, skinning, trapping, cooking, handling carcasses, or consuming infected animals. The full extent of the virus's presence in animal populations is still under investigation. Mpox can also be contracted from contaminated objects like clothing or linens, through sharp injuries in healthcare settings, or in community environments such as tattoo parlors. What are the signs and symptoms of Mpox? Mpox typically presents with symptoms that begin within a week of exposure, though they can appear anywhere from 1 to 21 days afterward. The illness usually lasts 2 to 4 weeks, but it may persist longer in individuals with weakened immune systems. Common symptoms of Mpox include rash, fever, sore throat, headache, muscle aches, back pain, low energy, swollen lymph nodes. For some individuals, the rash may be the first noticeable symptom, while others may experience different symptoms initially. The rash caused by Mpox starts as a flat sore that progresses into a fluid-filled blister. These blisters can be itchy or painful. As the rash heals, the lesions dry out, form a crust, and eventually fall off. The number of lesions can vary greatly from person to person, ranging from just a few to hundreds or more. These lesions can appear on various parts of the body, including palms of the hands and soles of the feet, face, mouth, and throat, groin and genital areas, anus. Some individuals may also experience painful swelling of the rectum or discomfort and difficulty when urinating. People with Mpox remain contagious until all sores have healed and a new layer of skin has formed over the affected areas. Certain groups, including children, pregnant individuals, and those with weakened immune systems, are at higher risk for complications from Mpox. How do the signs and symptoms of Mpox typically progress? In most cases of Mpox, the illness begins with fever, muscle aches, and a sore throat. The rash typically starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. The rash progresses through several stages over 2 to 4 weeks, evolving from flat spots, macules, to raised bumps, papules, then to fluid-filled blisters, vesicles, and pus-filled sores, pustules. The lesions often dip in the center before crusting over and eventually forming scabs that fall off. Swollen lymph nodes or lymphadenopathy are a distinctive feature of Mpox. Some individuals may be infected without showing any symptoms. However, during the global Mpox outbreak that began in 2022, caused predominantly by the clade B virus, the disease is presented differently in some cases. In more than half of these cases, the rash may appear first or simultaneously with other symptoms and may not spread widely across the body. The initial lesions can occur in the groin, anus, or in or around the mouth. What are the possible complications of Mpox? People with Mpox can become severely ill, experiencing a range of complications. These include bacterial skin infections, which can lead to abscesses or serious skin damage, pneumonia, corneal infection, potentially resulting in loss of vision, pain or difficulty swallowing, vomiting and diarrhea, which can cause severe dehydration or malnutrition, sepsis, a life-threatening condition where an infection spreads into the bloodstream, triggering a widespread inflammatory response. Inflammation of various organs, including the brain, encephalitis, heart, myocarditis, rectum, proctitis, genital organs, balanitis, and urinary passages, urethritis. Death. Individuals with suppressed immune systems, whether due to medication or underlying medical conditions, are at a higher risk of developing severe illness or dying from Mpox. This risk is particularly high for people living with HIV, especially if their condition is not well controlled or treated, as they are more likely to experience severe disease. How is Mpox diagnosed? Diagnosing Mpox can be challenging because its symptoms can resemble those of other infections and conditions. It's important to distinguish Mpox from illnesses such as chickenpox, measles, bacterial skin infections, scabies, herpes, syphilis, other sexually transmitted infections, STIs, and medication-related allergies. Additionally, it's possible for someone with Mpox to have another STI, like herpes, or for a child with suspected Mpox to also have chickenpox. Because of this, accurate testing is crucial to ensure proper treatment and to prevent further spread of the virus. The preferred method for diagnosing Mpox is through the detection of viral DNA using a polymerase chain reaction, PCR, test. The most reliable samples for this test are taken directly from the rash, including skin, fluid, or crusts collected through vigorous swabbing. If there are no skin lesions, testing can be conducted using oropharyngeal, anal, or rectal swabs. Blood tests are not recommended for diagnosing Mpox. Antibody detection methods are also not typically useful, as they cannot distinguish between different orthopox viruses. How is Mpox treated, and what are the options for vaccination? The primary goals of treating Mpox are to care for the rash, manage pain, and prevent complications. Early and supportive care is essential for managing symptoms and reducing the risk of further health issues. Vaccination is an important preventive measure against Mpox. Receiving the Mpox vaccine within 4 days of exposure to someone with the virus can help prevent infection. If there are no symptoms, vaccination can still be effective up to 14 days after exposure. Vaccination is especially recommended for individuals at high risk during an outbreak, including health workers at risk of exposure, men who have sex with men, people with multiple sexual partners, sex workers. Individuals diagnosed with Mpox should be isolated and cared for separately from others to prevent the spread of the virus. Antiviral treatments such as tecovirimat, initially developed for smallpox, have also been used to treat Mpox. Ongoing studies are being conducted to evaluate the effectiveness of these treatments for Mpox. What are the self-care tips and prevention measures for Mpox? Most people with Mpox will recover within 2 to 4 weeks. Here are some self-care practices to manage symptoms and prevent spreading the virus to others. Do: stay home and, if possible, isolate in your own room. Wash your hands frequently with soap and water or use hand sanitizer, especially before and after touching sores. Wear a mask and cover lesions when around others until your rash has healed. Keep your skin dry and uncovered unless you are in a room with someone else. Avoid touching items in shared spaces and regularly disinfect these areas. Use saltwater rinses for mouth sores. Take sitz baths or warm baths with baking soda or Epsom salts to soothe body sores. Use over-the-counter pain relievers like paracetamol, acetaminophen, or ibuprofen to manage discomfort. Do not pop blisters or scratch sores, as this can slow healing, spread the rash to other parts of your body, and lead to infections. Shave areas with sores until the scabs have healed and new skin has formed, as this can also spread the rash. To prevent the spread of Mpox, individuals with the virus should isolate at home or, if necessary, in a hospital throughout the infectious period, which lasts from the onset of symptoms until all lesions have healed and scabs have fallen off. Covering lesions and wearing a medical mask when around others can help reduce transmission. While using condoms during sex can lower the risk of contracting Mpox, it does not prevent transmission through skin-to-skin or mouth-to-skin contact. If this video was helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more content like this. Thanks for watching.